This is Heidi Gullett. I'm a family and public health physician, and I see patients at Neighborhood Family Practice. Today I will be discussing the multiple determinants of health. As I showed you in class, there are numerous mental models for understanding the multiple determinants of health, some of which are also known as the social determinants of health. I don't mind which mental model works best for you. I just want you to use a model that helps you best understand the things that make both individuals healthy and unhealthy, and populations or communities healthy and unhealthy. So as you see here, this is a common socioecologic model for understanding multiple determinants of health. And you'll see in the middle, you again have those individuals, right? They're individuals here. They have age, a sex, genetics, lots of predetermined factors, or factors that, when interplayed with other things like the environment, play out in a different kind of phenotype. Remember, we talked about epigenetics, and you're going to hear a lot more about that. But then as you go outside those factors, those modifiable and non-modifiable risk factors that have something to do with genetics, then you start looking at the individual lifestyle factors. And so this is things such as exercising, getting enough sleep, and eating in a healthy way, smoking, drinking too much alcohol, using illicit drugs. So it's important to understand that these lifestyle factors are not simply living in this middle domain by themselves. They are impacted, obviously, by these other domains outside. It can be easier to eat healthier and get a lot of sleep and exercise if you have conditions around you that allow that to happen. However, there's always still some element of individuals making healthy choices, and we talk about the fact that the healthy choice needs to be the easy choice. And in med school, you can see how hard it is for you to eat healthy, exercise regularly, and get enough sleep. It's going to be true for the rest of your careers, but also for the patients that you serve. They're going to have the same sort of challenges in living in a healthy lifestyle, unless we build environments around them that help those determinants of health be easier. Then you'll see as you go further out that there are social and community networks that are very important determinants of health. And an area of analysis that has recently been applied in different sort of public health arenas is social network analysis. So starting to understand how people's social networks impact their ability to make healthy behavior choices or to improve the health of communities. We have known anecdotally that social networks are very important both for individuals and communities, but beginning to measure that is very exciting. What I want you to know is that it is a determinant of health. Then you start to see these other social determinants of health. One that you don't see here are early life experiences. That's a really important one, as you heard from Dr. Marmot. But you also see here, there's all these other domains. So important. You learned from Dr. Malloy about living and working conditions and how environmental conditions impact people's ability to be healthy, and then may interplay with their genetics in really profound and complex ways that play out in the onset of chronic illness. You look at unemployment, the impact of that. You heard some about that during this block, and we'll hear more as you go on and as you talk to patients. Water and sanitation that we often take for granted are very important determinants of health. Healthcare services. So remember, what we do in medicine is very important. It's just not the only determinant of health, and I think that's sometimes hard for us to remember. And then housing is critically important. So not just the living conditions, but also the other stressors that come with living in circumstances of deprivation. And then finally, as you look out here, there are all these other multiple determinants of health: socioeconomic, cultural, environmental, beyond what we describe very concretely in that next area down. So I think you address some of these in your IQ case with Mrs. Sanchez, but you will further discuss these as you go forward. So one other mental model that you did see during the block, which I think is very helpful for understanding this concept of multiple determinants of health, is this framework developed by Dr. Eitan. You see on the right-hand side that we in the medical model often address the things that are listed more quote-unquote downstream. So we're looking at population health outcomes and status of populations with things like infant mortality and life expectancy. A little further upstream, we're looking at more specific chronic illness or infectious disease. And you see that genetics and individual health knowledge in this medical model are critically important, as are behavior and risk factors that come both from the individual and his or her immediate environment and the larger environment at large. And then you also see healthcare access plays an important role here. So on the right-hand side, you see in medicine and in our medical mental model, we're often focusing a little more downstream. But you'll see public health has always tended to focus a little more upstream. And this is more of the socioecologic model that I was discussing on the previous slide. And you'll see here that there are a lot of things around neighborhood condition and workplace conditions that public health has tended to work on. So they've worked often in these risk factor behavior and social inequities that are right in the middle of your screen, right? However, someone had asked me to further clarify the new public health. And what that is essentially taking the public health focus from the middle of the screen more upstream to the far left of your screen, where you're starting to address structural issues that impact everything else further downstream. Things like racism, things like poverty. So the new public health is not to the exclusion of the traditional public health activities that you see in the center, and it's certainly not to the exclusion of what we do in medicine. It's all quite complementary, but the goal is that we focus further upstream now in the quote new public health so that we're getting at structural issues, therefore our downstream consequences are not nearly as severe. Finally, this is just one more look at what we just discussed. So medicine has traditionally focused over here, where you see much more of a chronic illness perspective. Traditional public health has been around food and tobacco and infectious disease, and the new public health now focuses so much more on these upstream social issues, so poverty, racial segregation, racism resulting from that, etc. So just another way to take a look at how we're shifting our paradigm. And in all of this, we are all using population health principles to understand our common focus of improving both the health of individuals and communities.